our lecture today about the pathology of vessel. We put our lecture under line of vessel because body have much than one type of vessel. Body have blood vessel, artery and vein, and lymphatic vessel. We will start with the normal histology of artery and vein. As we take in histology, the artery major thickness has compared with vein. The tunica media of artery much thick compared with tunica adventitia. But within vein, the tunica media smaller than adventitia or equal in the size. This important difference helps us in pathology to identify which is vessel type we have under microscope, artery or vein. The artery, as we say, has a big tunica media, small tunica adventitia. Vein has the opposite, thick tunica adventitia, small tunica media. The role of this much thick tunica media to resist the high blood pressure which in with the artery compared with low blood pressure within vein. And the lumen here look like lymphatic vessel. It has a thin wall with nothing except few connective tissue. As we learn in our lecture, we will begin the lecture in systematic pathology with congenital malformation. We will talk about the artery and malformation, congenital anomalies of artery. The first one called peri-aneurysm. The subject aneurysm, we will talk under this subject in details in late time in our lecture. The peri-aneurysm, aneurysm in definition mean weakening and dilation of blood vessel, bulging structure from the blood vessel wall. The aneurysm, the congenital one, the peri-aneurysm, dangerous and fatal because it's occur any part of the body and the common part in the area called circle of Willis. In the circle of Willis, the peri-aneurysm may be hemorrhage and cause a severe clinical signs of death due to the localized of hemorrhage within the brain. The second congenital anomalies called arteriovenous fistula or arteriovenous malformation, suffix as AVM, arteriovenous malformation. As we know, the vein and artery meeting together or contact with each other in the area called capillary. This is in normal anatomical structure, on anatomical level, and this is has no difficulties, no signs, no disease. There's no disease. There's normal structure because the blood pressure within artery and within vein at this level, at capillary level, which is equal. So there is no dangerous to hemorrhage occur. But when the main vein meet main artery, when they met together, with not met on the capillary level, no, direct mating, direct contact, that will cause a hemorrhage and rupture in the vein. As we mentioned before, the wall of vein not satisfy the high blood pressure. Opposite to artery. Artery can manage this blood pressure. But when this blood under this pressure transfer from artery to the vein, vein will be ruptured and cause local hemorrhage at the site of arteriovenous malformation. This is in brain, fatal. And in other site, maybe within rest, it's not important, I think. As we see in the CT scan, the AVM within a brain, lead AVM within a brain, lead to massive hemorrhage, and as we say, it's fatal. The third congenital and important blood vessel anomalies called fibromuscular dysplasia. In fibromuscular dysplasia, the wall of the blood vessel become much thicker than normal due to increased fibrous tissue formation, a decrease also smooth muscle fibration. It has a serious complication. This complication with stenosis of the blood. It's commonly occur within renal artery and cause renal infarction. When the renal stenosis, the renal infarcted, as we describe the infarction in the general pathology. The next topic under the degenerative process called arteriosclerosis. Arteriosclerosis in divine mean hardening and thickening of the blood vessel wall. Arteriosclerosis have three types. Types number one called arteriolosclerosis. Arteriolosclerosis, hardening of the wall of small blood vessel. Blood vessel with arteriole, as the name, arteriole of the kidney here in this picture are hardening and increase the thickness of the wall, and this due to fibrinoid necrosis, as we mentioned it in the chapter degenerative process and the general pathology, also capillary of or small blood vessel capillaries of glomerular tuft, also sclerotic. The other type of hardening called Mönckeberg medial sclerosis. Mönckeberg medial sclerosis, it is age-related sclerosis or hardening. When the man become aged after 50 years old, fifth decade, the calcium become precipitate. The calcium precipitate within tunica media. When calcium precipitate lead to increased hardening, the wall become much stronger. The elasticity decrease. This type of calcification, which type, metastatic or dystrophic calcification? The answer will belong to you. This type of calcification, it is related to the age. So within age, the blood vessel become hard and hard. The third type of arteriosclerosis, and it is the most important type, called atherosclerosis. Athero, which is mean lipid. Atherolipid. It's related to atheroma formation. Atheroma formation mean accumulation of lipid beneath tunica intima. within tunica media. This accumulation of lipid occur mainly in large and medial size artery, characterized by, as we say, atheroma formation. Atherosclerosis has no clear etiology, but it have risk factors, many risk factors. These risk factors divided to modifiable risk factors, non-modifiable risk factors, additional risk factors. The modifiable risk factor include hypertension, hyperlipidemia, cigarette smoking, diabetes. Hyperlipidemia, the first one, this all of these are which are modifiable. Modifiable mean we can manage it, we can treat it, we can seize its dangerous on the body. Hyperlipidemia may be occur due to increased cholesterol consumption, due to genetic, as we see in familial hypercholesterolemia, maybe diet, hypercholesterol, maybe obesity. All these factors can lead to increased bad cholesterol in form of LDL, low density lipoprotein, as you take it in the physiology, and decrease HDL, good cholesterol. Hypertension, we will talk about this section extensively in the next pictures. Cigarette smoking, many researchers link between cigarette smoking and atherosclerosis and confine its relationship by the toxin, by the free radical, by injured endothelia, increase lipid, and cigarette smoking, as we know, make severe damage within body. Also, the cigarette smoking is those linked with atherosclerosis. Much more smoking, much more cigarette smoking lead to much more atherosclerosis incidence. Diabetes mellitus. Diabetes mellitus cause type 1 or type 2 or type 3, which is cause hyperlipidemia. Diabetes mellitus usually cause hyperlipidemia. When glucose is, the body turn over the metabolic process to the lipid and increase lipid production, and hyperlipidemia will occur. Also, diabetes mellitus generate free radical and endothelial injury, glycosylation, which is by glucose, and increase the injury to endothelial cell. Also, turbulent with coagulation occur within diabetes mellitus. All these factors are modifiable, which is mean can be treated, can be seized. You can cut cigarette smoking, you can manage diabetes mellitus, you can manage hypertension, you can manage the hyperlipidemia. The non-modifiable, before we go to the pathogenesis mechanism, the non-modifiable include age, sex, familial relation, and genetic. All these non-modified cannot manage. We cannot manage sex, the age. The incidence of atherosclerosis increase with an age, increase with men compared with female, men with women, increase with family with history with atherosclerosis. Genetic, as we say, familial hypercholesterolemia. The additional factor, not beneath modifiable or modifiable, the others include an increased C-reactive protein, increased inflammation, decrease physical activities, and stress, lifestyle stress. Also, the type A personality suffer more than other types of personality. Obesity, and at last, alcohol consumption. Alcohol consumption may reduce atherosclerosis incidence. This is lie, because there is no, you cannot control the volume of alcohol consumption. We say small amount of alcohol consumption prevent artery problems, and there is no thing called small amount. We drink, much drink, and drinker. Let's move to the pathogenesis of atherosclerosis. The pathogenesis of atherosclerosis built on hypotheses. We have three hypotheses in this section. The first one called inundation of lipid. Inundation of lipid, which means travel of lipid from the lumen to the tunica media. The second hypothesis called monoclonal adipocyte. Monoclonal adipocyte or foam cell. It's referred to proliferation of foam cell or adipocyte within tunica intima, and this adipocyte will proliferate and continues to become atheroma. The third hypothesis, and much acceptable one, and the much dependent one, called injury hypothesis. Injury to what? Injury to endothelial cell. When endothelial cell injured by free radical, toxin, drug, etc., it will be damaged and release cytokines and other chemical mediators that will recruit the monocyte to attach to the endothelial site, and this monocyte become transferred to the under endothelial site and become active, release cytokine, and this recruit other immune cell. Also, the damage to the barrier of endothelia lead to LDL travel from the lumen to the site of injury, site of inflammation. Macrophage will be engulf this lipid, this LDL form lipid, and turn over to foam cell. Foam cell, which is macrophage, engulf LDL. Macrophage, when engulf LDL, become a foam cell. With end of life span of macrophage, it will be die and releasing of cholesterol. This cholesterol deposit as atheroma. Also, the other inflammatory cell like T cell, macrophage, neutrophil, other by cytokine will initiate smooth muscle cell to migrate to the site of inflammation and proliferate within beneath tunica intima, and this fibrocyte from tunica media will migrate that make the site of inflammation become enlarged, and this enlarged depend on the lumen and cause lumen of blood vessel stenosis, maybe blockage. In this picture, we see that atherosclerosis maybe start with first decade of our age. Let's start with children, and it is developed as what we called it fatty streak. This fatty streak may be developed to become in the third decade of our life to become atheroma. Atheroma in the fifth decade or fourth decade will become fibroepithelioma, fibrothermo, fibroathyroma, fibroathyroma. This fibroathyroma is much bigger and cause an increase in the size of atheroma that will cause narrowing of the lumen of a blood vessel. Maybe at a later stage be ulcerated and thrombus formation. This is what we called it complication of lesion. Atherosclerosis plaque. The atherosclerosis plaque undergo the sequel. In this slide we discuss the sequel. The sequel may be, as we see, ulceration to atheroma, erosion, rupture. Rupture where? Rupture to the wall of a blood vessel. Rupture in the wall of a blood vessel in the site of atheroma due to weakness of the blood vessel wall. And this rupture lead to hemorrhage to the site. Let's we imagine the atherosclerosis within the brain, hemorrhage within the brain, fatal. Hemorrhage within the thoracic cavity, fatal. Hemorrhage within aorta, fatal. Also, the erosion and ulcerative plaque may cause thrombus formation. Thrombus formation and dislocation causes thromboembolism. Also, the weakening of the wall causes aneurysm formation. If the atherosclerosis stay chronically, it's become calcified and calcification formation. The next slide, we will talk about the aneurysm. Aneurysm by definition, aneurysm by definition, which is mean dilated within a blood vessel. Dilated the blood vessel due to weakness of the wall. Aneurysm classify depend on the origin, type of artery which involve, classify depend on the location, thoracic aneurysm, abdominal aneurysm, etc. Depend on the gross appearance of aneurysm, sacculated, as we see in the next slide, the sacculated or saccular aneurysm, fusiform aneurysm. The difference, the saccular from one side, the bulging occur one side, saccular, bulging occur in two sides, fusiform. There's other types called cylindrical aneurysm. Also depending on the composition of the wall of aneurysm, to true and false. True aneurysm, which is mean the all three layers involved in dilation. All three layers, media, adventitia, and intima, all of them are protruded, all of them are bulging. This is a true aneurysm. When one of them are dilated, weakening and dilated, this is called false aneurysm. Also, we have dissecting aneurysm, and it is a most dangerous type. The dissecting aneurysm characterized by damage to tunica intima or tunica media that lead to leakage of blood to the third layer, subtunica adventitia. This may cause, and usually it causes to hemorrhage, leakage of blood and hemorrhage. The pathogenesis of aneurysm, as we say, it is a weakening of a blood vessel wall. This weakening may be due to abnormal synthesis of connective tissue in many genetic diseases like Marfan syndrome. In Marfan syndrome, this is a defect in fibrin formation. Also, decrease in collagen. This causes a weakening of the wall. Also, maybe due to obstruction of blood vessel that lead to death of smooth muscle cell of artery, vascular smooth muscle, death by apoptosis. This death may weakening of the blood vessel wall. Also due to inflammation. When inflammation occur and matrix metalloprotease secreted, this protease will digest the smooth muscle, digest the collagen, digest extracellular matrix. All these cause extracellular matrix degradation. All this lead to weakening of wall. Weakening of wall with high blood pressure lead to dilation of the wall and bulging it as aneurysm. We have two important type of aneurysm. The first of them called abdominal aortic aneurysm. The side of this aneurysm between the renal branch and iliac branch from aorta. This side usually diagnoses accidentally during ultrasound to the pregnancy. She go to the gynae to make diagnosis for her child, and accidentally the ultrasonic specialist see aneurysm within this site. This aneurysm is very dangerous. It is rupture to internal to abdominal peritonitis, much severe complication, and it's fatal. It's treated by surgery, but by the grafts. The other important type, which is called thoracic aortic aneurysm. This aneurysm formed within thoracic arch, maybe in the ascending part, maybe in the descending part, maybe in the thoracic part. This aneurysm mainly occurs due to hypertension. May rupture of the wall cause thoracic hemorrhage and bleeding within thoracic cavity, and difficulties may lethal. The abdominal aortic aneurysm mainly occurs due to atherosclerosis. Thoracic aortic aneurysm mainly due to hypertension. The other section we would want to talk about aortic dissection. Aortic dissection, as we mentioned in aneurysm, there is a rupture in tunica media or within tunica intima, lead to leakage of blood to the tunica adventitia and circulated of blood. This blood depend on the size and location, may be a rupture of the wall and hemorrhage. It's mainly occur within thoracic aorta and abdominal aorta. It's occur in men between 40 and 60 with hypertension, suffer from the hypertension with the genetic disease as Marfan. Also, it's occur also due to laterogenic hypothesis. When used in surgery, after surgery, implant or anything others, maybe harm or damage to the tunica intima, lead to dissection of. Also, within the pregnancy, it's occur with unknown cause. The other topic we will talk, as we say, about hypertension. Hypertension, as we say, it's lead to atherosclerosis. Atherosclerosis also cause hypertension. The hypertension, not the causes here, not the types. Hypertension types are classified. It's classified into primary hypertension and secondary hypertension. The primary hypertension, also called idiopathic hypertension or essential hypertension. The idiopathic or essential hypertension, it's about 95% of the patient suffer from hypertensive. The secondary 5% only. The idiopathic hypertension may occur due to disturbance in the cardiac output or in the peripheral resistance. As we know, blood pressure generated by cardiac output, peripheral resistance. When peripheral resistance, cardiac blood pressure resistance. When cardiac output increase, the blood pressure increase. Peripheral increase, blood pressure increase. Cardiac increase, blood pressure increase. Cardiac output depend on the stroke volume or blood volume and depend on the heart rate. The peripheral resistance depend on vascular structure and vascular function. The pathogenesis of essential hypertension, as we know, the essential is idiopathic. Maybe there is a genetic influence, familial influence, maybe environmental factor, stress, personality, diet, activity, sex. All of these factors may cause hypertension. The defect of vascular smooth muscle growth and structure lead to increased vascular thickness, hardening, atherosclerosis, which is lead to increased vascular resistance, peripheral resistance lead to increased hypertension. Also, any defect in the sodium hemostasis, any defect within kidney that lead to sodium retention. When sodium retains with the blood, the water also retains. Water follow sodium. Water will retain within the blood. The volume of blood will be increased, and the plasma extracellular fluid will increase, and cardiac increase. So the hypertension will occur. The vasoconstrictive agent, as is inflammation or other, that will lead to increase vascular reactivity, increase vascular smooth muscle contraction, increase resistance, then increase to the hypertension. The role of kidney, very important in both primary and secondary hypertension. The normal physiology of kidney occur within juxtaglomeruli, sense to the volume of blood. When blood volume decrease as in stenosis, the juxtaglomeruli sense this and will secrete renin. Renin will be converted angiotensinogen to angiotensin 1, and then angiotensin 1 will convert to, by the lung, convert to angiotensin 2. Angiotensin 2 have two rules. The first one cause vasoconstrictive within a blood vessel wall, and that lead to increase peripheral resistance. So peripheral resistance increase, hypertension increase. Angiotensin 2 act on adrenal cortex to secrete aldosterone. Aldosterone cause retention in the sodium and increase retention of sodium, increase retention of water, increase that lead to increase water within the blood and increase blood volume that lead to increase cardiac output, and that cause hypertension. Let's move to the next slide. Let's talk about inflammation. Inflammation of the blood. About a vessel. Vessel inflammation called vasculitis. Pay attention. Vessel inflammation called vasculitis. Artery inflammation called arteritis. Vein inflammation called phlebitis. Lymphatic vessel inflammation called lymphanginitis. Vasculitis mostly refer to arteritis. Pathogenesis of arteritis or vasculitis classified depend on the causative to the non-infectious vasculitis and infectious vasculitis. Non-infectious vasculitis, which is immune-mediated mechanism, and the infectious vasculitis, it's direct invasion by the infectious pathogen. The infectious vasculitis may be mycotic, which is mean bacterial, not mycotic vasculitis, not mean fungal. Also, it's involve fungal, but it's fungal as aspergillosis, also bacterial. Both of them called mycotic vasculitis. The immune-mediated mechanism. We have many examples of this vasculitis, infectious vasculitis. The most important one called giant cell arteritis, also called temporal arteritis. Temporal because its main side effect, which is the temporal artery, become bulging from the skin. This type of inflammation with no unknown causative, but there is anti-neutrophil cytoplasm antibody formation with this type of arteritis. Also, it is T-cell mediated inflammation. The second branch or second type of immune arteritis called Polyarteritis Nodosa. It is a systemic necrotizing vasculitis. Systemic, as we see here in this photo, systemic, all the skin combined with dermatitis, cellulitis. But it is more common with patients suffer from hepatitis B virus. It is fatal if non-treated, and it is treatable with immune-suppressed treatment, immunosuppressive drug. Other types, Wegener syndrome, Wegener granuloma. Wegener granulomas is mainly granuloma within upper and lower respiratory system. Also, it is diffuse to the blood vessel and cause necrosis within the blood vessel and granuloma formation within the blood vessel, especially in kidney. We have also Kawasaki disease. It's anti-endothelial antibodies formation, anti-endothelia. It's characterized by red tongue within baby and systemic inflammation within all body, especially coronary artery of the heart. We have other immune disease with affect vascular system. It's called Buerger disease. The name misname. The Buerger not related to burger, but it's related to smoking, to smoker. The cigarette smoking with unknown pathogenesis suffer from gangrene within tip of its finger, also toe, also ear. This occurs due to stenosis of a blood vessel by a immune complex formation, occluded lumen of blood vessel. The inflammation characterized with occluded of the lumen, its location with tunica intima only, lead to obstruct the blood vessel and dead or infarcted tip of the hand. Takayasu disease, other type of immune-dependent or non-infectious vasculitis. Just know the name is enough. At last, we have raynaud phenomena or raynaud syndrome. Raynaud phenomena or raynaud syndrome. It's unknown phenomena, unknown etiology. It's familial, genetic, maybe. It's characterized by vasoconstrictive of blood vessel due to cold or due to emotional stress, lead to vasoconstrict of the tip of finger, then vasodilate. As we know, when vasoconstrict lead to pale of the area, and when the blood return to the site, it will become congested and become red. Between these two phases, the phase with cyanosis, So this phenomenon characterized by pale color, then cyanotic color, then red color of the hand. It is not important to treat it. It's that phenomena occur with blood vessel. At last, we will talk about artery tumor. Artery tumor classified not as usual to malignant and benign. It's divided also to intermediate grade. Benign tumor include hemangioma, capillary hemangioma, cavernous hemangioma. The difference between cavernous hemangioma and capillary hemangioma not seen by gross or naked eye. It's the need to histopathologist exam. The biogenic granuloma also benign neoplasia of artery tumor. Biogenic granuloma, the name not indicate to the case. Biogenic granuloma, which is mean proliferation of blood vessel within elevated tissue, granulated tissue. It's look like granulation tissue in healing. The intermediate grade neoplasia include Kaposi sarcoma and hemangioendothelioma. The malignant neoplasia, much malignant tumor called angiosarcoma, and there is a hemangiopericytoma occur with pericell within endothelial wall. Here is picture of hemangioma. And it is which type, cavernous or capillary, we don't know. Both of them are the same gross lesion. This intermediate type of tumor, it is Kaposi sarcoma. It's occur mainly with IDES patient. The more severe malignant tumor within the blood vessels called angiosarcoma. Necrotic area is obvious in this slide. We now turn our attention to the second part of vessel, to the vein. Vein inflammation, as we say, it's phlebitis inflammation, and the cause of inflammation of the vein, it is the same of the artery. But we have a special topic to the vein. It's called varicose. Varicose look like aneurysm in artery. Due to weakening of the wall. Also varicose within vein. It's maybe due to weakening or maybe due to valve of artery. As we know, the vein has a valve. This valve prevent blood from return due to the low pressure of blood within vein. And when there is a defect with this valve, this cause the blood become accumulate within vein and dilated of the vein wall, and which lead to the varicose formation. Varicose formation. Varicose occur in female more than male, occur due to obesity, due to long-standing pregnancy, also compression on the side. The familial and genetic play a big role in varicose formation within patients. The varicose is a major source for thrombus formation to the body, especially to the lung. The thrombophlebitis, Fibromuscular, it's related to stasis of a blood or hypercoagulability of a blood. The main one, stasis of a blood within vein due to valve defect, turbulent blood or stasis of blood cause a blood clot. There are another two topics important or phenomena or syndrome. It's a syndrome within a vein. A superior inferior vena cava syndrome. Vena cava before transfer the blood to the, as we know, transfer the blood to the heart. When superior or inferior vena cava occluded by compression of tumor in the thoracic or by congenital anomalies, by mechanical force, by trauma, by thrombus formation within vena cava and obstructed. All this cause edema formation. In the inferior vena cava problem, the edema appear in the neck and the head. And in the superior, the edema appear in the neck and head. In the inferior, the ascites and leg edema appear like nephrotic syndrome. At last, we will talk about lymphatic vessel. Lymphatic vessel, as we know from anatomy, it's near structure to the blood vessel. It acts the main function for it collect the extra fluid, the waste product, the waste of the cell, any leakage fluid, help to maintenance hydrostatic, amniotic and cortical pressure within tissue, extracellular matrix, and collect the extra fluid from the whole body, and protein also carries the lipid from the digestive to the hepatic. Return it to the vena cava and to the blood. The lymphatic suffer from inflammation under a term called lymphanginitis, maybe due to, as we see in this picture, characteristic features of inflammation localized or limited within a lymphatic vessel, alleviated and redness, also hot, I think. This site suffer from lymphanginitis, lymphatic vessel inflammation, lymphanginitis. But lymph node inflammation called lymphadenitis. This lymphadenitis may be insect bite. Lymphadenitis of lymph node like tonsillitis. At last, we will talk about lymphedema. Lymphedema may be occur due to obstruction of lymphatic vessel, lymphatic drainage, due to compression, tumor compression, deformity, force compression, all this cause. And sometimes due to infection, due to a tumor cell embolism that will obstruct lymphatic node and lead to lymph accumulation and lymph fail to collect excessive fluid from body and accumulation of fluid within body as edema. As here in this slide, in this picture, we see the left leg enlarged compared with the right one. This enlarged due to edema. This may be due to filaria Filaria parasite obstruct blood vessel, lymphatic vessel. This obstruct by filaria is called elephantiasis, and this cause lymphoedema formation. This type of edema called secondary edema or secondary obstruction. As we see, tumor cell, surgical, filaria, also by radiation therapy cause edema. The primary, there's another type of lymphoedema called primary edema, lymphoedema. It is congenital. It's congenital like familial miliary disease. Familial miliary disease, baby born with edema. And at last, thank you for your listening.